Segment is sponsored by the COVID-19 Vaccine Education and Equity Project. The season for sniffles is here, and while we've made strides in fighting COVID-19, new variants remain a threat. The updated COVID-19 vaccines are now available for everyone ages 6 months and over. And here to give us details on the updated shot is Dr. Regina Spratling. Regina, thank you so much for being here.
Thank you so much for having me.
Okay, why is COVID-19 still a threat for us, even though we have made strides? Why is it still a threat?
Well, we continue to have infections from COVID-19, and we continue to have more severe outcomes from COVID-19 infections. So it's really important that you get your child vaccinated and you also vaccinate yourself and your entire family.
Okay, so yeah, the latest vaccine is out and it's available. What do you say to parents that are maybe hesitant to get this new vaccine, not just for themselves, but for their children?
Well, this vaccine was tested through clinical trials with many, many children. Millions of doses have been given to children and have been monitored, and the evidence shows that these are safe and effective vaccines for children.
Okay, and of course, with the way that we've evolved and how we handle COVID-19, the coverage of vaccines has evolved too. Are they still free and available for children?
Vaccines are free for children.
Okay.
If you have insurance, they are covered through your insurance. And then if you are not insured, or if you are insured through Medicaid and other public programs, there is a Vaccines for Children program, and that program provides vaccines free to all children.
Okay, good information. And then where can parents go to find out? Because I know when it comes to vaccines, obviously the age of the child is important and the timing and everything. So how do parents go? Where do they go to find information on what's good for their child?
Well, I would say first contact your pediatric healthcare provider, or you can also contact your local health department. And then I do have some resources online that parents and families can look at. The first would be covidvaccineproject.org. I also would love for you to look at the National Association of Pediatric Nurse Practitioners website. We're known as NAPNAP, so it's napnap.org. And then there are also websites, vaccines.gov, and then also cdc.gov has a COVID-19 page as well. So there's a lot of great evidence-based resources out there for parents and families.
Yeah, lots of places for us to go. What do you say, Dr. Spratling, to your patients that are hesitant? Like, why do I need to get yet another COVID-19 vaccine?
Well, we have to continue to be diligent against this virus. It is changing and it continues to cause illness. And with children, when they're sick, they miss school and they miss other important things that children do, like sports and after school activities or events with friends and family. And if children miss school, the parents also miss work. And so it's really important to keep, children doing what they're supposed to be doing and what they love to do, and also kind of keep families to be able to function and not have those disruptions that illnesses can cause.
Right. Get as much protection as possible. Dr. Spratling, such great information. Thank you so very much.
Well, thank you for having me.
Absolutely. And again, for you at home, for more information, head to covidvaccineproject.org.